Hi, my name is Adalis, and today I will be showing you how to check the 6 vital signs. And today I have with me my brother Danny, and he will be helping me out. So there's 6 vital signs: pain, oxygen saturation, temperature, heart rate, respirations, and blood pressure. First, you'll start with pain, and you'll ask the patient to rate their pain on a scale of 0 to 10, 0 being no pain at all, and 10 being the most pain they've ever felt. And you'd ask them afterwards, like, where they are feeling their pain, and to just kind of to describe it. So, what is your pain? 0 on a scale of 0 to 10.
A 3.
A 3. And where are you experiencing pain?
Right on the left elbow.
Right on the left elbow. Okay. And what does it feel like?
Just pain, pretty much.
So it just hurts. So then you'd record that data. Next is oxygen saturation. And you'll have that clip thing, and that goes right on your finger, and there is like a light in there, and you'd put that right on the nail bed, right at the light, and it'll read through that, and you'd get your oxygen saturation. And this is also known as O2 SAS, and the normal levels for that are 95 to 100. So we'll be checking that right now. Okay, no, I'll just put that right there for now. Okay. So you slip it in right to where the light is, and you'll have the patient relax and just hold it there. Okay, this is reading 97, so that is in the normal range. Next is temperature. You can check this orally, so through the mouth, axillary on your armpits, temporal, tympanically, or rectally. Rectally is usually used in pediatrics and older patients, but today we'll be using the oral method. Normal temperatures would be 97 to 99 degrees Fahrenheit. So what you're going to do, you turn it on, and you'd have the patient open their mouth, and you place the little silver thing right under their tongue. And then you'd wait until that goes off and record the data. Another thing to know is that if you were to use that axillary or temporal, it would be 1 degree lower than orally. And if you do rectally or tympanically, it would be 1 degree higher than orally. So we'll just wait. Keep your mouth closed. Alright, so this reads 98.6, and that is normal. Next is heart rate. You could also check respirations with this together, because normally if you were to ask to tell a patient you were going to check their respirations, their breathing can change, and you want to make sure you get accurate readings. So what you could do is you'd count the breaths per minute and the heart rate and the beeps per minute together. So you'd check heart rate first. For the first 30 seconds you'd count, and then respirations the next 30 seconds you'd count how many there is. And for heart rate, you can check this using the radial pulse, the brachial, which is right in this bend in the elbow right here, or carotid right here. And the normal rate for that is 60 to 100 beeps per minute. And so we'll check this and the respiration. So for the respirations, it's about 12 to 20 breaths per minute. And so since we are just doing counting to 30 for each, you'd get you'd count what you like, get your information, and then you times it by 2. So you have to remember. So we'll start here in a second. I will be using radial pulsing. You never want to use your thumb because that has a pulse. So you find the pulse and we'll begin. Okay, so for his heart rate, I counted 30, so that is normal. You times that by 2, you'd get 60 beats per minute, and that is in the normal range. And for respirations, I counted 12, and it isn't also in the normal range, which is 12 to 20 breaths per minute. The last and final vital sign is checking blood pressure. Different places have different methods of doing this, but you just have to follow the protocol for the department and where you work. And so if you were to do this manually, where you'd have to pump it, here on the armband there'd be 2 arrows, and you'd want to put that about 1 to 2 inches above this radial pulse if you'd feel it. So his is about right here, and you'd put that about 2 inches above. Okay, so we'll just slip this on right here. And you want to make sure it's not too tight. Okay. And see, that is about, probably need to lower it a little bit because, okay. So that's about 2 inches above that brachial pulse. And so what we'll do is turn this on and have the patient relax their arm. Normal ranges for your blood pressure is more than 120/80 and less than 140/90. So we'll just wait and see what this says. You want to make sure the patient is relaxed, or you can get inaccurate readings and you don't want that. Okay, so we have a 122/93. That's normal. So it's more than 120/80 and it's less than 140/90. So that is normal. So after you are done checking the 6 vital signs, you'll record the data as you go, and then you'd share that information with your patient. And then after, you could ask about their pain, how they got that, and questions about their pain. But that is all.